The next assessment that I'll be going over is internal rotation of the shoulder complex. So with this will be, the muscles that we'll be assessing is infraspinatus and the teres major. Optimal range of motion here is 45 degrees. So what we're going to have our client do is lay supine. The non-assessment arm will be in neutral. Assessment arm will be AB ducted, 90 degrees out towards the side of the body, so kind of just like this. No rotational anything, nice and neutral, just abducted 90 degrees outward. Then you're going to make sure that their palm and everything is in a neutral position, so fingertips should be facing towards the ceiling, just like this. And we're going to take our application head and place it on the lateral side of the elbow, so right out here. And we're going to take the stationary head and draw a line perpendicular to the floor. So this is the floor, my hand right here. Then we're going to make sure that the stationary head is perpendicular to the floor. Then we're going to take our measuring head, the one with the numbers on it, and align it to the lateral side of the ulna. So make sure that it's placed in the middle, lateral side of the ulna, just like that. So with this, we're looking for 45 degrees. So that would be right about here. And then when we passively push them into internal rotation, we're going to have their arm like this. Then we're going to try to push it down, as much as we can. Then we're going to record our results. If there is any sign of compensation, so let's say our client tests like 35 or 40, then we're going to say that their range of motion is limited, and some underactive muscles that we could look at further is the subscapularis, the teres major, the pectoralis major, the latissimus dorsi, or the anterior deltoids. When we're doing the assessment, I forgot to mention, the first signs of compensation would be upper elevation of the shoulders, so this shrugging motion, as well as like the opposite shoulder kind of pushes outward or pushes inward. So movement in the opposite shoulder too would be a sign of compensation. And then we would position them back, so we'd resist just a little bit less until we see that there's no signs of compensation before we record our results.